Namaste. Welcome to Holistic Human Health session. Today we'll discuss about spinal problems. Before we start, we'll just wait for a few minutes so that others will join. And meanwhile, if you have any questions, you can just raise your hand. We will give you the mic and we can take a few questions. Everyone is having the mic. You can unmute and if there are any questions. Okay, fine. Then I will go ahead with the today's session. So, back pain is one of the excruciating pains man can ever experience in his own life. And nowadays, not just old people, even young people, even in children, this back pain is very common. One in every five people are experiencing back pain at least once in their own lifetime. So, such excruciating pain can be avoided if we maintain a good lifestyle and take good care of our own spine and correct our posture regularly with complete awareness. So, when you look at other animals, all the animals are well balanced on four legs and their whole body weight is uniformly distributed over their body. Whereas human beings, they walk on two legs and their weight is concentrated on the lower back region, on the knees, on the heels, because of the vertical posture. And if you look at the backbone, this bone is not exactly a single bone. There are around 33 small bones. On the right side, you can see three bones one upon another. They are called vertebrae. There are 33 bones like that. On the left side, you can see there are 33 bones one upon another. And in Telugu, we call these vertebrae as Vennu Pusa. Pusa is a bead. Bead is something which is having a hole in it through which the thread can pass so that a chain can be made out of the beads. Similarly, all these vertebrae are like beads, and through the holes of the beads, spinal cord passes. Spinal cord, which is an extension of our brain, passes through the backbone, which is not exactly a single bone. There are 33 bones. Through these 33 bones, the spinal cord passes. And this spinal cord is a continuation of the brain. And at every joint, a pair of nerves come out. You can see the blue color spinal cord going through the holes of the bones. And on both sides, the nerves, spinal nerves are coming out of the spinal cord. So exactly at that place, you can see the purple color disc, which is called intervertebral disc, which acts as a cushion between two bones, two vertebrae. So between every two vertebrae, you can see this intervertebral disc. This disc is also part of the skeletal system, but it is not bone. It is not solid like bone. This disc is having almost 80% of the disc is filled with some fluid, which gives it the unique way of cushioning action between two bones. Whenever you lift some weight or stand for a long duration or sit for a long duration or bend forward or travel on a jerky road, two bones they hit each other, and the disc in between is like a cushion, is like a shock absorber, which gives a lot of cushioning action to both the bones. It When the both bones come closer, it pushes them back to their own position. Such a elastic intervertebral disc sometimes becomes very degenerated and the liquid gets reduced, and because of this degeneration and lack of liquid in it, the disc gets compressed and it will not recoil. And when there is more pressure due to the compression, the disc comes out of its place. Imagine if there are two bread slices and you put some jam in it and press, the jam comes out of the bread slices, right? Similarly, when two bones press the disc and the disc is not able to recoil, then it gets compressed and it comes out of its place and it presses the spine. It compresses the spinal cord. This is what happens when you compress when there is a disc compression, disc degeneration. So when the spinal cord gets compressed, it obviously shows a lot of pain in that particular region because it is a bundle of nerves. All the sensitive nerves get compressed and there will be pain. See, the blue color disc which is there, when it gets compressed, it goes towards the black color hole through which the spinal cord travels and it then compresses it. So there is some animation, but it is not available and not visible in the Zoom thing. So you can see that the blue color disc is just adjacent to the yellow color spinal cord. Whenever there is compression, the disc comes out of its place and touches the spinal cord, yellow color spinal cord, and then it causes severe excruciating pain in that particular region. You can clearly see in this picture, the disc is actually a photograph. On the left side, you can see two vertebrae, and in between the vertebrae, there is a intervertebral disc, and the disc, which is supposed to be stay aligned to the vertebrae, came out of its place. And on the right side, the white color spinal cord is visible. The disc, which came out of its place, is compressing the spinal cord, which is causing severe pain. In this MRI, you can see that on the left side, you can see all the vertebrae, and in between, gray color discs are there. The last disc is not gray in color, it is black in color. It is L5S1 disc, generally the last disc. The blackish discoloration of this disc indicates there is degeneration. I don't know if the mouse is visible or not. I'm just hovering my mouse there. So this blackish discoloration indicates a degeneration, and this particular disc is compressing the white color spinal cord. And because of this compression, there is severe pain in that particular region. And if you look at the right side picture, you can see the brain on the top of the MRI, and the brain continues below as a spinal cord, and there are white color bones or vertebrae, and in between the vertebrae there are black color discs. Normally these discs are in gray color, but the black color indicates degeneration, and a blue color arrow is showing one disc which is coming out of its place and compressing the spinal cord severely, and in that place there is severe pain. So this is in the neck region. The left side MRI is of the lower back region, and the right side one is in the neck region. Now if you look at the picture on the left side, the spinal nerves which are coming out of the spinal cord are shown in yellow color. Nerves which are coming out of the neck region, they are entering into the hand and going till the fingers, and some nerves from the neck region are entering the head, and some nerves from the lower back region, they are entering the leg and going till the fingers of the leg, toes. So the nerves which are carrying information from the brain are traveling till the toes to all the parts of the body from the spinal cord. And on the right side of the slide, you can see this spinal cord, and both the sides there are nerves coming out, and the blue purple color disc which came out of its place is compressing the spinal cord. Not spinal cord, the nerve coming out of the spinal cord. There is a round indicating reddish compression where the disc is compressing the spinal cord. So the nerve which is getting compressed will affect the entire part of the body which is being innervated by that particular nerve. For example, in this picture, you can see one nerve which is coming out of the lower back region is going till the leg, till the heel. And if that particular nerve is getting compressed, you can see the reddish region indicating pain and radiating pain and numbness and all over, burning sensation all over the whole leg. That is the place where there is severe compression. Severe compression and severe pain because of the compression in the nerve. In the lower back region, there is compression, but the radiating pain is extending throughout the leg. It depends upon which nerve is getting compressed. If the L4 nerve is getting compressed, it travels till the anterior part of the leg, lower leg. If the L3 nerve is getting compressed, it only travels till the knee joint. If the S1 nerve is getting compressed, you can see the areas where there will be the problem. L5 nerve, it travels through the leg and till the big toe. S1 nerve till the small toe, small finger of the leg. So wherever this nerve goes, it causes severe pain, radiating pain, and also burning sensation and numbness. The problem is not in the leg region. Problem is in the lower back region where the nerve root is getting compressed. But the problem will be seen in the entire part of the leg. Joseph Jairaji, you have raised your hand. I am giving you the mic. If you have any question, you can ask.
Namaste, Bhaiya.
Namaste, Jasupji.
Yes, I can hear.
Yeah.
This is sciatic nerve problem I'm having. So
yes.
For that, what is the reason and how we can remove it?
Yeah, that's exactly what I'm explaining.
Okay, sciatic nerve you will explain. Thank you.
Yeah, the nerve which you are looking at in the slide, the reddish discoloration is there on the left side. You are looking at the nerve now.
Yes.
That is sciatic nerve. It is getting compressed in the lower back region. That is the reason why the entire course of the nerve, the leg, entire leg is having problem, pain.
Okay, I am not able to sit in the Padmasana position.
Yeah, that is because of the compression of the nerve.
Okay.
So I'll tell you what to do.
Okay, thank you.
Okay. Similarly, if the nerves coming out of the neck region, if they get compressed, see in this particular picture, the nerves from the neck region are entering the shoulder and the arm. So on the right side, you can see the regions which are getting affected due to the compression of nerve which is entering the arm. The entire arm, whole hand from the shoulder till fingers of the hand, there is pain, tingling sensation, radiating pain, burning sensation, different symptoms. So depending upon which nerve is getting compressed, there will be different problems, different symptoms, but the problem is common, that is degeneration. See, on the top, you can see the normal disc between two vertebrae or bones in the spinal cord, backbone. That is a normal disc. But the next disc, you can see the degeneration in the disc. And because of the degeneration, there is compression and the disc is bulging out of its place, the third disc. And the fourth disc, you can see the liquid is also coming out of its place. Liquid, which is supposed to be staying inside the disc. And there is a thinning of the disc. Disc between two bones gets compressed and it becomes very, very thin. Then the bones also get degenerated. And there is, very thin film of disc, which is not sufficient for lubricating and not sufficient for cushioning action. So this is the course of degeneration from initial stage to the advanced stages. So in the right side, you can see initial disc degeneration, then there is disc prolapse, disc extrusion when the disc, there will be a rupture in the outer coating and the liquid comes out and it also spills out. Sequestration also happens. These are all different stages. Normally, allopathic doctors say that in this stage you have to go for surgery. Initial stages, they might say you do some exercise, do some maybe apply some oil or do some physiotherapy or take some bed rest. All those things will not stop the degeneration. And after some time, when the degeneration sets in and there is disc extrusion, doctors will say go for surgery. And what is surgery? They will remove the disc. They will remove the disc between two bones, and in its place they put some steel plates and screws, and they fix both the bones up and down. So both the bones will become one single bone. If you remove two discs, all the three bones will become one single bone. The problem with this surgery is you will not be able to bend forward or move sideways. Then there is no disc in between two bones. That movements will be restricted because of the fixation of these bones. But many people go for surgery because even if the movement is restricted, at least there will be relief from pain. So let me get some relief from pain. They go for surgery. The problem with this particular surgery is that it is very complicated surgery. Breaking the skull and opening the brain and doing some surgery is much easier than doing a spinal surgery, because the spinal cord is a smaller part and very delicate, and if you open it and you try to cut the disc, and while cutting the disc, while removing the disc, if you cut the nerve which is getting compressed by that particular disc, when the nerve gets damaged, there can be permanent damage, there can be permanent paralysis of the hand or leg, or even sometimes you may lose your life because it is a complicated surgery. Of course, with God's grace, and if you're lucky, sometimes maybe the surgery will happen without any complications. But even if that happens, successfully you will be removing one particular disc which is coming out of its place, but there are so many other discs which are also in different stages of degeneration. When you remove the discs which are taking the entire weight, then you will be putting weight on other discs, because these discs are no longer taking any weight. The other discs which are adjacent to those discs, they will take weight, and that will cause the other discs also to come out of their own place. So this problem might recur again and again, and you can't go on perform surgeries one after another wherever there is a degeneration, wherever there is a disc prolapse. And moreover, the cartilage you are looking at between two bones is not just present in your backbone, but in every joint, whether it is your shoulder joint or elbow joint or wrist joint or knee joint or ankle joint or hip joint, anywhere, wherever there is a movement between two bones, you will be having this cartilage as a lubricating agent between these two bones. And if the degeneration sets in, it can happen at any place, not just in the lower back region or in the neck region. It can happen in your knee, it can happen in your hip, it can happen in your ankle also. Nowadays, in my clinic, I am getting so many patients with avascular necrosis, where is severe degeneration in the hip joint. And this particular disease, also called as avian, avascular necrosis, is increasing in many patients after COVID, particularly for those people who have taken a large dose of steroids. Nowadays, we are treating so many patients with that particular degeneration. So degeneration can happen any place, not just in your lower back region. So performing surgery in all the places is not the solution. Solution is to stop the degeneration and start the regeneration. And to know how to do that, we need to understand why exactly this degeneration happened. If you look at your human body, so many organs are there, so many parts of the body need nourishment at a regular basis, and the food which we consume is having enough nutrients to nourish each and every cell of our body. All the organs, all the organ systems, every part of the body will get nourishment from the food we take. But if a particular part of the body is not getting proper nourishment, there the degeneration can happen. You might ask me, I'm taking good food, why there is degeneration in one particular part of my body? Maybe you are taking the nutritious food, but just taking it is not enough. That food should get properly digested and should get properly distributed. The assimilation process should happen properly. That should reach the skeletal system where the food is getting converted into energy and also used for tissue building. If that happens, there will be no degeneration. But sometimes the set of chemical reactions which help in distributing the food all over the body, these chemical reactions can get disturbed if there is an accumulation of free radicals. Free radicals are nothing but ions. Free because they are traveling all over the body. Radicals because they are disturbing other chemical reactions so that they can become stable. So the chain of triggered chemical reactions happen due to the free radicals, and this thing disturbs these chemical reactions and it will not allow the food to reach the skeletal system. And in those areas, there will be degeneration where there is no steady supply of nutrients. Now, you might ask me why these free radicals are getting produced. These free radicals are also called as endotoxins. They are called endotoxins because these toxins are getting produced inside our body. And when these endotoxins get produced inside our body, they disturb the chemical reaction. Now, why are these endotoxins getting produced inside our own body? There are so many reasons which are precipitating for the production, increasing the production of free radicals. Sometimes taking, as I have told you, excess consumption of harmful medicines like steroids or some chronic consumption of painkillers and all those things can produce more free radicals. Lot of stress, not sleeping in time, not eating in time, not getting up in time, no physical activity, no exposure to sunlight, lot of stress, anxiety, tension, fear, mental instability, eating a lot of unhealthy food, and then bad habits, pollution, hormonal imbalances, all these things are contributors for the accumulation of free radicals, which in turn disturb the chemical reactions, which will cause malnourishment to certain parts of the body where the degeneration starts. So it's very important for us to understand that this can be reversed without undergoing dangerous surgeries, without taking harmful painkillers, without recurrence in future. So how do we do that? First, we have to stop the degeneration process. Further, we perform cellular detoxification therapies called Panchakarma, in which Vamana Karma and Virechana Karma help in removing toxins from each and every cell of our body. Once these toxins go out of the body, the whole body stops degenerating. So with these detoxification therapies, we kickstart the regeneration process, but we will also stop the degeneration process. So there will be no further degeneration. But what about those places where there is already degeneration? Those places where there is already degeneration, there we have to do some metabolic correction therapies and regenerative therapies. The therapies which you are looking at in the slide are external therapies, massages, Kativasti, Shashtikshali, Pindasveda, Sarvangadhara. All these therapies help in improving the blood circulation, strengthening the joints, and reducing pain, giving more flexibility to the body. All these things are very effective. But these will help only for pain relief and to increase the flexibility. There is a special therapy called Vasti Karma, which will actually regenerate the cartilage in all places between every two bones. Wherever there is cartilage, that will be regenerated. Wherever there is degeneration, there will be regeneration with the help of this metabolism correction therapy called Vasti Karma, which is the third therapy of Panchakarmas. Of course, there is also Nasya Karma, fourth therapy of Panchakarmas, which will also help in strengthening the cervical region, neck region strengthening also will happen with that. But now the question is regeneration possible? Many people ask us, many friends of us, they told me that regeneration is not possible. Once the cartilage and bone gets degenerated, there is no other way except to replace them with artificial joints. This is what many people think. This is happening because there is a long history of preconditioning by many people around us, including doctors, who told us that degeneration is not possible. There is no way your body can regenerate itself. And because of this preconditioning, every one of us do not believe that we can help ourselves. It is the doctor's duty to help us, that and in any way he can help us. If he wants to remove a disc, we will let him remove the disc without taking any responsibility for our own body. This is what we have known till now. Why is this happening? And because of this wrong conditioning, even though we have the power of regeneration, that regeneration is not happening. In Kerala, they train the elephants in a peculiar way, where they tie the elephant with a very small rope when the elephant is a baby elephant. For that baby elephant, this rope is strong enough to hold it. And they train it using that rope till it becomes a big elephant. It becomes so big, like Mother Gaja. It can even break away the iron chains or uproot huge trees to which it is tied to. But if you tie it with that childhood rope with which it got trained, it will not move an inch. Because in the mind, it got preconditioned that I will not be able to free myself if someone ties me with this particular rope. So it got tuned, it got preconditioned. So it will never move. Similarly, we all got preconditioned that we will not be able to regenerate ourselves if there is a degeneration in a particular part of the body. But the fact is far from this. Truth is different. In fact, human body is like a flowing river. See, you can't step into the same water twice because the river is there, but the water is continuously flowing. If you step in, you touch a water which immediately flows away, and again you step in again, there will be new water. Similarly, in the human body also, we think that human body is like a statue which is fixed in time and space. No, it is not. It is dynamic. It is not static. Each and every cell of the body is taking birth and performs its functions, and then it dies. And new cells get produced. It happens in each and every cell of our body. Every cell takes birth, performs its functions, and then dies. So, what I am trying to tell you is, because every cell is replaced by a new cell, it is possible to regenerate the degenerated cartilage. But why is it not happening? See, I am not telling you what Ayurveda is telling. I am just telling you the scientific research. The cells in your skin, they live only for 30 days. The cells in your stomach wall, they live only for 5 days. Cells in your liver, they live only for 45 days. That is the reason why someone donates half part of his liver to a person who needs liver transplantation. Both of them grow their liver very soon to their original size because the liver is having a regenerative capacity, highest regenerative capacity. But even other cells, they grow faster. That is the reason why you are donating blood. Because blood cells, they live only for 120 days, that is 4 months. So if you donate your old blood is helping other people and new blood is getting produced. Even if you don't donate, they will die anyway, those cells. So similarly, skeletal system cells, they live only for 90 days, which means in 3 months, the entire skeletal system is getting replaced. I can tell you in my own body right now, all the cells which are present in my skeletal system will not be present after 3 months. All of them will get replaced. Now you might ask, if that is the case, today I'm taking an X-ray or MRI, and after 3 months, if I take an X-ray or MRI, because all the cells are getting replaced, the new MRI should show a strong, spine, strong skeleton, which is not the case. Why is it not so? Why the new cells which are getting produced are not getting produced in the right way? Imagine there is a building. Imagine my hospital building is there, which I have built with my own money. And after some 50 years, the government says this building is in ruins. It has to be demolished. It is not safe. But I am attached to the building. And I take the help of science. Maybe after 50 years, there can be advancement in science where you don't have to demolish it. You can replace each brick with a new super strong brick. And when you replace all the bricks, the whole building will become a new building. But imagine if you replace the old building, old brick with another old brick, which is also weak. The entire building gets replaced, but still there is a weak building only. So the old cells are dying, but the new cells which are getting produced are not produced in a right way. They are again weak. Why? Because the raw material to produce a super strong cell is not reaching that particular part of the body, so that the body is not producing super strong bone cells, cartilage cells. That is the reason why regeneration is not happening. So we have to create the environment in our own body in such a way that the regeneration will happen. Body will regenerate itself, and body should get enough nourishment. And when you remove the free radicals, the nourishment starts. Of course, these are some vastis which we give to the patients, Erandamuladi vasti, which is very effective. We send this medicine through the anal route, and this helps in regenerating the cartilage in each and every joint. There is this Tiktaka vasti, which is a very effective vasti for people with severe degeneration in the knee joints. Both the knees getting completely degenerated, needing total knee replacement. For such people, we give this Tiktaka vasti, and the cartilage gets regenerated. And there is Vaitarnavasti, which is very effective in reducing severe pain, excruciating pain in spinal cord. And there is Bruhatya Dhyapanavasti. There are so many other vastis. And the nasal drops, which we give through the nose, it's called Nasya Karma. We use the Shirabala, Dhanvantram, Maharaj Prasad Nitailam drops, which will strengthen the neck region also. And there is this Vahni Karma. Vahni Karma is a special therapy, also called as Agni Karma, designed by father of surgery, Shushruta. We identify delicate points in the spine region where the disc is compressing the nerve, and we try to send thermal energy through a special instrument called Agni Karma Shalaka to those tender points, and this helps in fixing the discs and strengthening the spinal cord and backbone. It's very, very effective therapy. It also gives instant relief from pain. So a combination of all these therapies will help in problem solving. But all these therapies constitute one particular part in solving your problem. The second part is to eat in time, sleep in time, get up in time, avoid all those food items which can cause degeneration, take all those food items which will help in regeneration, particularly the skeletal system. And then the third part is to keep your mind peaceful, stress-free, so that the regeneration happens naturally. Further, you need to practice asanas, pranayam, and dhyana, meditation, along with some exercises for spinal strengthening. So all these three things together will help you solve your problem completely. You will get 100% solution to your spine problem when you do all these three things. So first thing is the therapy which will be performed by your doctor. But second and third parts, lifestyle corrections, have to be performed by you only. Of course, there are food items which will help in regeneration, like fruits, dry fruits, milk, ghee, vegetables, buttermilk, freshly cooked food, millets, different millets, different grains which are growing in our area, like ragi and all, til seeds, curry leaves, of course, exposure to sunlight. All these things will help in nourishing the thing. Food has to be cooked very fresh and eaten immediately. That will help in regenerating the skeletal system. Excess fried food, spicy food, oily food, all these things will cause degeneration. Reheated items, pickles, some things like potatoes, pumpkins, they will increase pain. Jackfruit, banana, solid curd, tomato, non-vegetarian food, cool drinks, chilled items, processed foods, preserved foods, sauces, jams, canned food, tinned food, all these things will cause degeneration. So avoid these foods to stop degeneration in your parts of the body. It's very important for us to not consume all these things. Otherwise, naturally degeneration will happen. Aging process will start very fast, and you will be much older than your chronological age. Your physiological age will be much more than your chronological age if you consume those food items. And of course, we need a lot of lifestyle changes, like sleeping by 10 p.m., waking up before sunrise, breakfast before 8 a.m., lunch before 1 p.m., dinner before 7:30 p.m. Before starting this session only, I had my lunch, dinner, and I started this session. And I request all the participants to have this lunch before you enter this session, or while listening to me also you can have lunch, but don't wait till the session gets completed to have your lunch. If you have not taken your lunch, it is already 8:11. So while you are listening to me, please have your lunch. Avoiding pollution, practicing spinal exercises to strengthen backbone and spinal cord, regular pranayama and meditation for better regeneration of cartilage and bones. Of course, prioritizing life, which will help in reducing stress and tension. Avoiding foods grown using pesticides and fertilizers. Of course, helping others and taking social responsibility also brings beautiful changes in our own life, along with our health. So I strongly recommend doing something good for others so that the regeneration happens faster in our bodies. Of course, it is very important for us to be aware of ourselves. If you are not maintaining a good posture, that itself will cause a lot of troubles in your spine. It's very important for us to see that when you stand, your whole body is there on one straight line without any curvatures. There is a small curvature in the lower back region, but other than that, it should not be overly curved back or forward drooping and all those things, backward swaying. All these things are not good. If you are using the mobile phone in an excess time period, bending forward will severely damage your neck region and will cause severe cervical pain. And eventually other problems like tennis elbow and other problems will ulnar nerve palsy, all those things will happen if the neck is getting strained. If you are using a desktop computer, so screen should be directly in line with your eyes. You should not bend your neck to look at the screen which is below. The screen should be above. or you increase the table's height so that the screen will be exactly opposite to your eyes. And if you look at the angle between your trunk and your thighs, it can be 90 degrees or more than 90 degrees, but never less than 90 degrees. Less than 90 degrees means you are bending, just like the picture on the right side. If you are bending, then there is a problem. The angle at your knee joint, if you look at the picture on the left side, the angle at the knee joint is, 90 degrees or more than 90 degrees, but never less than 90 degrees. The legs can stay like this, or you can put your legs on the footrest on your table, but never bend them inwards into the chair. So on the right side, that is the wrong position, and the left side is the right position. And people with spinal problems, they should not put pressure on their lower backs until the spine gets strengthened. So avoid bending forward to lift heavy weights. If at all you want to bend your knees, sit down, take the item, and then stand up without bending your lower back. On the left side, it is the wrong way. Right side, because it is an animation, it is not visible here in Zoom. But you have to sit down and lift something. There are other things where you can damage your spine. It is very important for us to have awareness about your posture. If your posture is bad, everything is bad. So you can try Bhujangasana, Shalabhasana, Dhanurasana, Marjalasana, Ustrasana, all these asanas. You are bending your spine backwards, and that will strengthen and it will push the discs back to their own place. Never practice any asanas where you bend your body forwards. And there are some exercises like in this, you're seeing, looking at the Bhujangasana, and here you are lifting your leg. If you left the both legs, it will be Shalabhasana. Here you are lifting one hand and another leg, opposite leg, like right hand and left leg, left hand and right leg, like this. Here you are lifting both the legs and the upper part of the body, only touching the floor at the umbilical region. Here you are trying to hold your legs and push, lift your entire body. All these asanas are good for lower back problem. The neck, you can do some dynamic exercises where you bend your neck forward and back while taking breath. Similarly, on the left side, you look at left side, on the right side, left side and right side. You can look at the wall located on the left side. You can look at the wall located on the right side, like this. You can also bend your head on left side so that the left ear will touch your left shoulder. Similarly, bend on the right side, right ear will touch your right shoulder, like that. Similarly, you can just do these things. You can take your head forwards and backwards, lift your shoulders. And of course, you can make a rotation, complete rotation, clockwise and anti-clockwise. And there are some static exercises where you can push your head with your hand on one side while maintaining the head's position without bending the head. Apply pressure with your head and on your head with your hand. Similarly, on the opposite side. And on the bottom, you can see, you can push your forehead with both your hands, but don't allow the head to go back. Keep your head firm. Similarly, from back side also, with both the hands, try to push your head forward, but don't take your head forward. Stop your head, push your hands with your head, like that. These are the static exercises. You can do waist rotation, hip rotation, spinal stretch on side to side, spinal stretch forward, backward, torso twist, hand twisting along with your spine. So these things you can do. These are some things which you can do. So exercises, pranayama, meditation, having good food, and also if the problem is severe, undergoing panchakarma. These are the secrets for complete regeneration of your degenerated discs, and this will help in solving your problem. So if you have any questions regarding back pain or neck pain or degenerative, any like disc prolapse, disc bulge, disc herniation, disc, like spondylolisthesis, any problem related to the backbone, you can ask me. I can answer your questions now.
Namaste, Bhaiya.
Namaste.
I was asking about sciatic pain, no? So, is
Yes.
there any special treatment?
This is the treatment which I have told you right now, the Panchakarma therapy, which is comprising of 3 stages. One is stopping the degeneration by doing detoxification therapies. And then the second one, this is called cellular detoxification, which will stop the degeneration. Second one is regeneration. It's not those therapies, these are external therapies, but along with that, there is a special therapy called Vasti. And then we will do Vahni Karma. Vahni Karma is a special therapy which will strengthen the discs in such a way that they will not press the sciatic nerve. And once the sciatic nerve becomes free and the disc goes into its own position and gets fixed there and it will not come out, then the sciatic problem will get permanently solved. Okay.
Okay. Along with the this spondylitis, there is fat also accumulated over the waist or the neck or the thighs. So for that, what we have to do?
See, both are related, sir. If the food is not nourishing your skeletal system, not nourishing your cartilage, where is it going? It is getting converted into fat. And because the fat is getting accumulated, body is gaining weight. Because there is more weight, there is more pressure on the spinal cord, more pressure on the lower back, and it is further causing more degeneration, more compression of the disc. And it is a vicious circle. And when you correct the degeneration and start regeneration, regeneration will happen, skeletal system will become strong, and it will not allow the accumulation of fat. It will consume all the food in such a way that every part of the food which you are consuming will get converted into the strength and help in tissue building of the spinal back skeletal system. So there will be no production of fat. So you'll lose weight also if you undergo these Panchakarma therapies.
And do you support this idea that we should take food and go to sleep and get up at the correct particular time, or whenever we have hunger we can eat, whenever we get sleep we have to sleep? So which one do you advocate?
See, eating food in right time, sleeping in right time, these are the precursors for any regeneration. Regeneration should happen, then food and lifestyle should change. Without eating in time, without sleeping in time, you will never be able to regenerate any part of your body. So then you might say, I'm not feeling hunger in the right time. So you have to train in such a way that if you are not getting hunger, you skip the entire meal so that in the next time, the next time when you eat, that time you will have proper hunger. You have to train your body in such a way that body will feel hunger only in the right time, not in the wrong time. In that time, when you can tune in with the universe, which will also help in production of digestive enzymes to digest the food properly, so that it will get distributed and assimilated properly, and it will nourish the skeletal system. If you are not eating in right time, body will not be able to digest the food in right way, so a lot of toxins will get produced, and that will cause further problems. So eating in right time is very important, but training the body in such a way that it will express the hunger only in the right time. Similarly, sleeping right time is very important. You have to train your body in such a way that you get sleep early in the night time.
So for a person of about 50 years age, how many hours sleep do you advocate?
6 to 8 hours is enough, more than enough, but in the right time. Ideal time is between 9 to 5, but at least by 10 o'clock, if you can sleep, that will be the best.
Sometimes due to emotional burst or tension, I tend to eat more some savories or something. So then again, when I eat normally also I eat, but I think I overeat. So how to stop this habit of eating in between due to stress?
See, the key for all these problems is awareness. If you are continuously aware of yourself, your body, and you know when your mind is getting disturbed and when it is seeking, craving for bad food, and what are the circumstances leading to that craving, then you will be able to plan in such a way that you will not give in to those cravings. And that is very important for us to strengthen our spine, strengthen our body. And further, the continuous awareness is very important. If there is no awareness, then you will not listen to the body, you will not observe your lifestyle, you will not watch what you eat, and you will eat whatever is available or whatever is desirable, whatever is tasty, and that obviously causes problem. So observing yourself, observing your body, observing your mind, and also establishing a connection between yourself and your body, and feeling that responsibility towards your body, understanding that the body is a wonderful tool to achieve your all goals in this particular life. This body is very important. And once you understand that importance, you will be very responsible to your body, and you will give it only those food items which will nourish it, not those food items which will cause temporary joy or pleasure. It's very important for us to practice awareness, which will push away the negative emotions and wrong cravings, and also free you from stress and disturbances.
And drinking early in the morning in the empty stomach,
Drinking what?
drinking about 1 liter of water and then lime juice and then cow's urine or eating chavan prash, will all that help us?
Yes, we spoke volumes about the water part. You can drink water early in the morning only before sunrise. After sunrise, if you get up, then don't drink 1 liter of water. Just drink whatever is needed. Don't drink liters of water after sunrise. Only before sunrise it can be done. After sunrise, the enzyme production will start, and then if you take a lot of water, all those enzymes will get diluted, and that will disturb your digestive system. So after sunrise, you can, if you are getting up after the sunrise, maybe you can take 1 or 2 glasses of water, not more than that.
Because normally when we take 1 liter of water or 3-4 glass of water, within 10 minutes the emotions also come, so we feel free.
See, for that you should not do this thing. Drinking water in the morning before sunrise is known as rasayana therapy in Ayurveda. Rasayanam et jara vyadinasanam. You can postpone the diseases and old age by practicing certain rasayanas, and one of them is ushapana, or drinking water early in the morning. So the purpose of drinking water early in the morning is to regenerate your body, not for bowel movement, not like a pressure thing which will push the balls downwards. They should happen naturally, even if you don't drink water. That should happen by taking enough fiber and also enough lubrication, and also eating early, and all those things will help in better motion. But not for that. The drinking water early in the morning is not for that. It is for regeneration.
Can we have once in a month enema?
Yes, you can have enema once in a month if there is some difficulty in passing stools regularly. You can have, but more than that, every day you have to ensure that you are having complete bowel evacuation early in the morning. For that, you have to get up early in the morning before sunrise. That is the best time for removing the toxins from the body.
Some nights when we feel stomach bloating or indigestion, can we take the medicine for as a laxative, which are made up of natural herbs?
Yeah, you can take laxatives, but frequently, if there is bloating or indigestion, then you have to use some herbs which will correct the indigestion thing.
Okay, thank you, Bhaiya.
Namaste. So if you have any other questions, we have 2 more minutes. We will take. Otherwise, we can close the session.
And Bhaiya, all these photographs you put, are they available in that website also? That is SIP
Which
website.
website?
SIP
Which
website.
website?
Our AICTE SIP website, Students Induction Program.
If you look at the left hand corner, this particular session is streaming live on the same AICTE YouTube channel, and immediately after this session, you can see the same video. It will be there forever. AICTE-SIP.
Dr. Garu, namaste.
Namaste, Geeta Garu.
Dr. Garu, Panchakarma, you said, no? That I live in Hyderabad. Is it possible that I can, you recommend that I can go for this somewhere in this location?
Yes, you can have Panchakarma in Hyderabad.
If you recommend any particular place, I can, because
yes, you can just drop a mail. I will suggest few locations where you can have this therapy.
Thank you so much, Doctor. I'll do that. I want to go for this because I think it will make me feel much better.
Sure, and sure.
Thank you, Doctor.
Welcome.
Namaste.
Patanjali's center is there in West Maradupalli.
Yeah. Vinod Gupta ji. There is mic for you. You can unmute and talk. Vinod Gupta ji. If no one else is having any questions, then we can stop. Actually, we have a holistic human health session from tomorrow onwards for 7 days at our hospital. People from different places, they have come. They are waiting for me for instructions for tomorrow's session. So I will. Nirupam ji, you have questions? Okay, please go ahead. There are some hands raised. Okay, I am just allowing you to talk. Nirupam ji and Amresh Pantal ji.
Yeah, namaste, sir.
Namaste, Nirupam ji.
Namaste, sabhi ko. Yeah. Actually, in my family, I have a means I am her auntie. He's suffering from
ankylosing spondylitis.
Yeah. And actually, he's very young guy. Means I think 20 to 25 years only. So, is it possible to because he's taking taking a treatment from different places, but he's always
ankylosing spondylitis.
Yeah.
Ankylosing spondylitis is an autoimmune disorder where our immune cells attack our own spine. If you look at the slide, see the spine becomes a bamboo spine where the bones they fuse together and the cartilage in between becomes solid, and there is no flexibility in the spine. They will not be able to bend or do anything. Completely bamboo spine will happen. So this can be reversed. Ankylosing spondylitis can be reversed with Panchakarma. So we can reverse this fusion of the bones, and we can make the spine flexible again with Panchakarma. So that is possible.
Sir, please suggest me. Means we have to send to your center.
Yeah, you can send them to my center, my hospital.
But actually, he's not well versed with English.
Hindi is fine, na?
Okay. Hindi is fine, na?
हाँ, हिंदी में बात करते हैं.
अच्छा ठीक है बढ़िया ठीक है भैया और and I have some more questions actually my father my 78 years old father from for whom I have taken medicines for his chronic constipation also actually he's also having those cartilage issues in his knees So because I have taken to him हड्डी and stroke मतलब ortho doctor, but they have suggested that that knee transplant like
No,
kind of
knee
thing.
transplantation is
But
not
actually yeah.
not recommended actually. Total knee replacement. Without total knee replacement, we can regenerate the cartilage between the knee joint. That is possible with Panchakarma. You have my number now. You can call me and we can discuss about
Okay.
it.
Yeah.
Okay.
Okay, sir. Sir, when may I call just after the session or?
No, just after the session, I have another session. Maybe you can call me tomorrow at 12
Yeah.
o'clock.
That's why.
Okay.
Okay, fine.
Yeah.
Thank you. Thanks a lot.
Namaste. Amresh Patil ji.
Yeah.
Namaste.
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 It was just to inquire regarding the drop in the weight. Yeah. So I was earlier 78 to 79 kgs when I started understanding this UHV content and the holistic health. Now with a lot of awareness and all that, I will not be having much of what do you say, stomach full. So with that, I had told earlier also around 7 to 8 kgs. Now it has come up to 10 kgs. Somewhere it is now 68 or 60.
Oh, wonderful.
Yeah, Bhaiya, is that, but everyone, whoever looks at me, they always tell that, okay, you are not well and all that.
No, as long as you are active and you are comfortable with your body, you need not worry about what others say.
Yeah. Okay. But is this going to be dropping continuous? But sometimes what they say is you need to go to dietitian and ask for how much is really required, so that I think you're eating less
if
than.
you are eating right food and doing physical activity, body will lose weight till it becomes ideal, then it will stop.
Okay,
you will not lose any further than required.
Yeah, thank you for this.
Namaste.
Thank you. Namaste.
Manuji.
Ji bhaiya. Namaste bhaiya.
Yes.
Even I was having certain questions because one of my elder brother is also facing some problem related to spine because he was having some lymphomia in his spine.
So
he been to